Hi, everybody. God bless you all.
Quand il me prend dans ses bras, il me parle tout bas, je vois la vie en rose.
Hi guys, welcome to the LAT Time Capsule episode 13. This is Sedna and I'm 17 in grade 11. Today we will be exploring what the journey to becoming a doctor in Canada actually looks like, the challenges students face along the way, and why so many students in our generation are drawn to medicine. At Laredo Abbey, many students dream about careers in healthcare, whether it's becoming doctors, nurses, surgeons, or researchers. Medicine is often seen as one of the most respected but also demanding careers. In 2026, students are balancing academics, extracurriculars, volunteer work, and pressure about the future while still trying to pursue extremely competitive programs. I have asked a couple of students in Laredo Abbey, what comes to your mind when you hear the word doctor?
Hi, my name's Michaela, and when I think of the word doctor, I think of someone that could heal you and help you physically or mentally when you're unwell.
Hi, I'm Vanessa, and when I think of the word doctor, I think of a person who saves lives of other people.
Hi, I'm Donna Lynn. When I think of doctors, I think of caring and hardworking people who help others stay healthy and safe.
For so many students, the pathway starts long before medical school. So right now, I'm in grade 11 and I already planned the classes that I'm going to take in grade 12 to be ready for university. I'm going to take, obviously, English, advanced functions, biology, chemistry, calculus and vectors, and physics, which is recommended. And many students also participate in extracurricular activities like HOSA, volunteering, leadership programs, and healthcare-related clubs like Youth in Medicine, which I'm the senior executive, and next year I'm going to be the president, which I'm so excited for that. Or like myself, that I'm doing my co-op placement in the clinic at Beverly Hills, that is a urology clinic, and I have gained a lot of hands-on experience because I perform bladder scans on patients and I do uroflows. Also, I help patients to write clinical assessment forms when they just come to the clinic. Because for a good undergraduate program, university look more than just grades. So after high school, we go to getting our bachelor's degree. Common undergraduate majors include biology, health sciences, psychology, neuroscience, and life sciences. Medical schools in Canada do not require one specific major, but students just need to have the prerequisite courses to apply for doing the MCAT and going to med school, but not one specific required major. And after getting the bachelor's degree, the students go to med school. But before going to med school, students are required to take the MCAT, which is the Medical College Admission Test. And it is one of the biggest challenges for many students that want to become doctors. That's what I heard. And we have 7 operating medical schools in Ontario, and we have 2 medical schools located in Toronto, which are University of Toronto and TMU. The exam tests biology, psychology, chemistry, critical analysis skills, and many students spend months preparing for it. And if accepted into medical school, students spend approximately 4 years learning diagnosis, clinical skills, anatomy, and patient care. Medical students divide their time between classrooms learning and hospital placements, where they gain real-world experiences working with patients. And that leads to this episode being proudly sponsored by Nespresso. Whenever you're studying for chemistry, writing lab reports, or questioning your life choices at 2 a.m., Nespresso is there for you. Thank you, Nespresso, because organic chemistry at 8 a.m. should honestly be legal. Heidi, this is such a great opportunity for me. Would you like to introduce yourself for listeners?
Hi, my name is Heidi, and I'm a first-year med student at TMU.
Thank you so much. So one of the questions I really want to ask you is that now in my position, I'm in high school, but looking back, what's something you wish you knew when you were in high school yourself?
I tell myself to stop comparing my progress to everyone else's. I think that everyone's journey is different, and constantly comparing yourself just creates unnecessary stress.
That's such a great advice, especially for the listeners that are still in high school. They're dealing with stress, a lot of homework, assignments, and that advice is really important because at the end of the day, these are a few years left and we gotta enjoy high school at its best. What advice would you give to me? Students are interested in medicine or interested in the healthcare field.
I'd say focus on building good study habits and learning how to manage your time, because those skills become really important later on.
Heidi, thank you so much for your advice and the time that you have gave me for the interview. And I wish you all the best on your studies. After medical school, students continue training through residency programs in hospitals. The length of the residency depends on the specialty. For example, family medicine may take around 2 years, while specialties such as neurosurgery can take approximately 7 years. Many students also experience stress, burnout, and pressure through the process because of the journey of becoming a doctor can take more than a decade and require years of sacrifice and hard work. Today I have asked a couple of questions from the healthcare professionals that work in the clinic at Beverly Hills. Thank you so much for being part of my project. This really means a lot for me. So I'm going to ask you a couple of questions, but would you like to introduce yourself first?
Hi, my name is Kieran. I'm a nurse practitioner at the TCBH Surgical Center.
So one of the questions is, well, when did you know that medicine or healthcare was right for you?
So I grew up with my grandparents, and it involved me taking care of them as well as them taking care of me. And from there, I knew I wanted to go into medicine because I wanted to help people and help our elderly.
What does a typical day look like for you? And do you just work in this clinic or you work in hospitals too?
So I work both at this clinic and I also work at the hospital. A typical day for me here starts at 7 or 7:30. I come into the office, I prep all of the rooms, and I check to see which of my patients are coming in so I can best take care of them and have everything ready for them.
Okay, that's great. Thank you so much. And I have this last question that is for our students in Laredo Abbey is what advice would you give to high school students that are interested in healthcare or medicine?
So healthcare and medicine is a long journey, but it's very rewarding. The best thing I can tell you is even when it's hard, don't give up.
Thank you so much. Thank you for your time, and I really appreciate it. For my time capsule item, I have choose to include a printed picture of myself in the clinic at Beverly Hills. That's the clinic that I did my co-op placement in. This photo represents who I am in high school, a student trying to balance school, co-op, and pressure about the future and hopes. I choose this because this episode is not only about the process of becoming a doctor, but also dreams and ambitions that many students that are my age have. When this capsule is open in 2047, I hope it will remind me of where my journey started and the goals that I had as a 17 years old, a student that is still in grade 11. Although the pathway to medicine is long and challenging, one thing I believe from in these interviews and the research I have done is that success is not about being perfect. It is about being resilient and continuing forward during difficult moments. Maybe not everyone listening right now will become a doctor, but every student chasing a dream today is already building a part of their future. Thank you so much to the LAT 2026 Time Capsule. This was your host, Sedna, grade 11, and I hope to see you next time.